Welcome, everyone. Um, Thank you for joining us for Creative Healing for Youth in Pain, or CHIPS, webinar, Chronic Pain and School Functioning. My name is Samantha Levy. I'm a clinical psychologist, and I specialize in working with kids and young adults with chronic pain and other medical ailments, such as dysautonomia. Within the CHIP community, I run parent and teen groups and write a parenting blog, as well as moderate and speak for the monthly webinars. For those of you who are new to our community, CHIP is an online nonprofit organization that empowers youth living with chronic pain to heal by altering the brain's pain circuits through exposure to creative healing experiences, educational resources, and peer support. Our guest, Dr. Deirdre Logan, is a director of psychology services in the Division of Pain Medicine at Boston Children's Hospital and professor of psychology at Harvard Medical School. Dr. Logan has led the psychology program in pain medicine at Boston Children's Hospital since 2007, overseeing multiple outpatient clinics and 2 intensive pain rehabilitation programs. Dr. Logan's research focuses on the psychological aspects of pediatric chronic pain, with emphasis on the roles of school and family systems in the child's pain experience. She has published over 90 peer-reviewed papers and has edited the Pediatric Pain Letter Journal. Currently, Dr. Logan is working on ways to use digital health technology, particularly extended reality interventions, to advance the treatment of chronic pain conditions. Okay, now we're ready to begin. Thank you for joining us, Dr. Logan.
Thank you for having me.
Of course. So why don't we just start by you telling us a little bit about your research and clinical work around school functioning with youth in chronic pain, and then we can get into the nitty-gritty.
Absolutely. So I am, as you said, at Boston Children's Hospital in our pain treatment service, where I have held both clinical and research duties for over 20 years. And throughout that time, I've been really intrigued by the fact that we see so many kids coming in with complex chronic pain problems who really show the whole range in terms of how it affects their school functioning. So we see kids with pretty complex, severe pain problems who are still getting to school every day. And we see other kids with similar or even less extensive problems who really haven't been able to get to school at all, and then everything in between. And I've long been really intrigued with trying to figure out, what it is that really either supports school functioning in one kid or makes it so challenging in another kid, that I have really tried to focus a program of research around trying to understand the many different answers to that. So I've done a number of studies looking at factors that seem to influence kids' school functioning. I have done some qualitative work with school staff to really understand what it is that they see when they're looking at a student in their classroom with pain and what they need in order to feel more confident in addressing those problems and supporting those kids. I have done some vignette-based studies with teachers to try to understand, how they're really interpreting those kinds of conditions. And then most recently have moved into exploring digital technology solutions to really see if we can create school-like conditions in our treatment settings and work with kids to address the barriers and to help them find ways to overcome some of those challenges and integrate back into school, particularly after our intensive rehab program. So that's a lot of what I've been working on, and a lot of the same things come up in my clinical work as well as those research programs.
Yeah, using the virtual reality is like a really souped up version of the desensitization that we've always used
Exactly. It's an
with
exposure, and it's one
visualization.
that we can
Yeah.
do right there in the clinic. So that's been a neat tool to try to work with to see if
Yeah.
we can leverage that.
Okay, well, we'll get into that more later, I think. But
Mhm.
first, I'm just curious, based on what you're saying, have you come to any conclusions or insights about what makes one kid not go to school and the other go to school with maybe the same level of pain? Of course, we can't know exactly what people's pain is, but with, obviously as best as we can
Yes.
figure
Yep.
out.
I would say, there, what makes this really challenging is that there are always so many individual factors, and you really can't just replicate. There's no perfect set of accommodations or exact same thing that seems to be happening for kids, but there are some recurrent themes. One of which is kind of the relationship between the kid and family and the school personnel, and if there's really some trust and some kind of points of contact there, so that parents don't feel they're sending their kid off who's struggling kind of into a void where they're not sure what's going on, that makes a huge difference. And that's something that we try to work with clinically to support that. We see anxiety play a huge role. So a lot of overlap between coping with pain issues and coping with anxiety. And if you've got both of those things going on, it really intensifies, I think, the school avoidance or school anxiety piece of things for a lot of kids. So that's a kind of a common theme. We see a lot of kids who, have pushed themselves really hard in the school setting. And I think kind of set the bar high in terms of their own expectations or have others perceived expectations on them. And the stress of that and kind of the mounting stress that we see all kids facing in school, I think is another important factor that pops up quite frequently. So those are some of the common themes. Again, acknowledging that it's never the same thing twice.
Yeah, you talk about the importance of partnering with the schools and trying to find someone at school who can understand and communicate. I think finding someone who can communicate with the teachers and help build that bridge between the
Mhm.
family and the teachers is often really helpful, I find, whether it's a counselor or a nurse or vice principal or whatever. What do you find are the important factors um, in terms of that partnership with the school? Like, what do you
Yeah, I
feel
would.
like they really need to understand?
Mhm. One of the key things I think it's really crucial to convey is, chronic pain is a real condition. I think a lot of times, in the absence of kind of that validating information from a healthcare team, a lot of school professionals are left kind of wondering, well, why is it that this kid seems to be doing okay one day and not okay the next day, or okay at lunch but struggling in math class, and they start to question, is this kid trying to pull something over on me? Is
Right.
this, not really a medical issue? So trying to convey that biopsychosocial framework. And yes, this is a medical issue. And also, it is exacerbated by stress. And it's not uncommon to see kids vary in how they're able to tackle different situations or vary one day to another. Um, really trying to validate that piece, which most likely the kids and or the parents have already tried to convey, but giving it that sort of stamp of yes, this is a thing, I think goes really far. Uh, and I also think sort of working together to kind of suggest the kinds of accommodations that might be most helpful, I think is also really important. Toward that end of trying to figure out, what do schools really need to understand? I've recently become part of a kind of growing consortium that's come out of some working with some great folks in Australia called the International Pain in Schools Alliance. And this is work by Beck Fechner and Josh Pate, who've really tried to focus on, how do we get more pain education in schools? Can we do it through, sort of curriculum level changes so that, school personnel get more exposure to understanding chronic pain, or things about chronic pain are taught in health classes so that more kids understand and that there's a little bit more acceptance on the peer level. So working at those kind of systems level changes, as well as working on the individual, what this kid, who their system is and who we need to talk to in that system. I think the change needs to happen on both of those levels to really be successful.
Yeah, because I find that a lot of what keeps kids from going back to school is not just what happens in the classroom academically, but what to say to peers. Because you're talking
Right.
about they look fine one day and not the other, or at lunch, and then kids also start to see that difference and feel like they're
Mhm.
faking it. So a lot of what I talk to my clients about is what to say to other kids. So what have you found to be helpful in that way?
Yeah, absolutely. One of the things that happens in our rehab program is the kids will work on kind of a list of frequently asked questions, and they will generate the kinds of questions that they think or worry that they're going to get upon return to the school system, and then they'll role play and work those out and have their answers ready. And I think that's really important to kind of understand what they're worried about, what they think these questions are that are going to feel hard for them, and help them to anticipate that, and help them feel comfortable. If they want to give a lot of information, great. If they want to give a little information, also great. Helping them sort of figure out what feels right to them and then have it kind of in their back pocket when they actually have to face those situations.
Yeah, I find that teenagers tend to not really want to hear a lot of medical details. So, I
Hmm.
usually talk to my clients about making it short, simple, and not contagious sounding. Uh,
Yes, those are the keys
so,
for sure.
very simple, like I have a pain problem with my leg. Sometimes it hurts way more than others. So sometimes I can deal with it, and sometimes it's really flared up and painful, and I can't.
Mhm.
Just something really simple like that. But I
Yep,
find that not
absolutely.
having an answer ready really keeps a lot of kids from going to school.
Exactly. Yeah, that
Um,
practice piece is so key.
yeah, and what about the social part of just being kind of out of the loop?
Yeah, it's huge. I mean, and it becomes such a snowball effect. You miss a few days and you worry, well, what's it going to be like when I go back? And I'm not going to know what's going on, or, there's going to be a weird dynamic at the cafeteria table. It doesn't take much to feel like you've kind of slipped behind socially. And so that becomes another factor, I think, that really plays into the sort of mounting avoidance piece. So, one of the things that I think is really powerful about some of our treatments being group based is that kids can talk to other kids who are navigating those same challenges. And so they don't feel quite as isolated. And once they can kind of brush their social skills up with those kids who understand, I think they have a little bit of a better platform to jump off of when trying to kind of reintegrate with their outside peers. So I think that that helps a lot. But there absolutely are fears around, feeling left behind. And we do work to try to help slowly reconnect, maybe reaching out to one or two kids to kind of, refuel some closer relationships before you jump right back into the whole fray.
Right, right. I have a parent who's asking a question about public versus private school, but just letting that person know we'll get to that. I want to go through some of the basic school interface first, and then we can talk about private versus public. But one of the parents said for those kids who don't want to answer many questions, business cards that they can hand out when someone asks can be helpful. Sure.
Mm-hmm.
Uh-huh.
Yep.
Yeah, anything that they can find.
Whatever works. That's why role playing is great. Like figure out what feels good to a particular kid. Do they want to be handing something out? Do they want their little elevator pitch? Figuring out what feels comfortable on an individual basis, I think, is a great idea to be creative around.
Right, exactly. So we're gonna talk about accommodations. So I want to ask you specifically about what accommodations you think are helpful. And one of the parents is asking specifically within that concept, if they don't have a confirmed diagnosis, like let's say CRPS,
Mhm.
and they just have chronic pain, how do they convey that? So, if you can talk about what accommodations are helpful and sort of how it works if they don't have a specific diagnosis.
Sure. So first part first, what accommodations? I'm going to sound like a little bit of a broken record, I fear, but again, um, there is no one size fits all. And we sort of try to take this open-minded approach every time we're sitting with a particular kid and really listen to what their limitations are, what pain gets in the way of in school, and also think about what is their school environment. Sometimes we will ask for more because we get the sense that we're working with a school that really isn't going to jump in and give a lot. Other times we hear from the family, the school's really understanding. And so maybe there can be a little less dictating of what needs to happen. So there's so many factors. But the typical sort of menu of accommodations that we're often sort of talking about with families to see what feels like a fit could include, I think, probably the most common one we make is um, this kid may need permission and opportunities to kind of step out of class for a few minutes, maybe go to the nurse's office, wherever it is, and use the skills that they're learning in working with their pain providers or whoever in relaxation and nervous system regulation, and then be able to return to the class. That is so much better than getting to the point where they can't handle it anymore and they need to call their parents and go home. So that's a common one. Can they please take breaks, keep them brief, have them be, with a particular goal in mind, and then return to the classroom. Sometimes preferential seating in a class can be helpful, either to be able to step out and take those breaks or to be able to go use the bathroom, or sometimes they just need a sort of movement break. And so going to the bathroom is just a chance to walk around the hall for a lap and then return. Um, Sometimes an extra set of books so they're not carrying everything from place to place if they're all over a school, or permission to have a locker. There's, in our region at least, fewer and fewer lockers, so a lot of kids will tell me, well, we don't have a locker. But then if we ask the school, they're like, well, we have some places that can be used if needed. So you're not carrying everything around, or an extra set of books in the classes, those kinds of things. Um, sometimes having an extra couple of minutes to pass through hallways so that you can either leave before the crush or wait out the crush of everybody changing classes at once can be helpful. Of course, it depends on the kind of pain condition. So with headaches in particular, thinking about, ways that there could be maybe reduced access to constant bright lights, or reduced time in front of a screen. or ways that, there can be some quieter settings that the child can work in, or at least take tests in. Um, and then there's the idea of, sometimes with kids who've been out for a prolonged period of time, we do a gradual reentry. So we don't say when they come to our clinic, oh, you haven't been in school for 3 months, start going to school, 7 hours a day starting tomorrow. It's a gradual thing where we will work to come up with a schedule where maybe, in the next week, they're going to try to be in school an hour a couple of times, and you sort of build from there. So that really depends on how much has been missed. And we also try to think of these accommodations as not things that are necessarily going to be put in place forever, but are hopefully things to start with. And as kids are building skills through hopefully a treatment plan, they may need less and less, or fewer and fewer of those accommodations over time. So we try not to make it sound like this is a forever sort of situation. The second part of the question was about, what do you do when there's not a clear-cut diagnosis? We have a lot of language that we use to describe chronic pain conditions. And, we will put that in a letter. So, maybe sometimes I can say the student presents with a complex regional pain syndrome. Other times I can say this student has come to our team with a chronic pain syndrome characterized by nervous system, central sensitization of the nervous system. Ways to describe things that I think people will take seriously. And again, not think we're saying this child has pain that's all in their head or something dismissive. But hopefully we can use some language that is accurate and yet also kind of formal, and helps people say, okay, so there's something here that we need to respond to.
Yeah, exactly. I think that when we use that language, the schools don't know any difference really between having a specific diagnosis.
Right.
Um,
They don't know if there's an ICD-10 code with the sentence I just.
exactly, exactly. We're going to talk about, I want to get back to talking more about the reintegration slowly into school in a minute, but first I want to just finish talking about the accommodations, and then we'll talk more about the school reintegration. And
Mhm.
for the parent who asked about IEP and 504, we're going to definitely get to that also. Um, so in terms of the accommodations, I would say that just a couple that I would add to that would be um, having more time to complete homework. If,
Mhm.
if they have a flare up and they're not at school, that they have extra time, or maybe have extra time anyway. And for some of my clients, that some of the teachers will reduce the workload, like every other math problem, or you don't have to do these spelling and vocabulary sheets, just write the essays, or, try to cut out some of the busy work. So
Mhm.
sometimes reducing the load can help. Um,
I would say that's especially important if you're dealing with a kid who's got makeup work and also trying to keep going. So that can be totally overwhelming. The idea of like, well, now I got to make up 3 weeks that I missed and also pay attention to everything going forward. So that is a particular time when I will make that request of, can we cut down on these assignments and just get them to do enough that they can focus on the going forward.
Right, and with that, we kind of go to the show proficiency,
Yeah.
like, okay, we just need to show proficiency in this topic. And I find with elementary school or middle school, almost never does the school say keep them back. I mean, they're
Right.
really just
Right.
like, okay, yeah, you've shown proficiency. And because most of our kids are really smart, they typically have proficiency in the topic most of the time. And so the teachers will let them just do the very necessary work. You did mention though reintegrating to school slowly, and I know you talked a little bit about it, but I think it warrants a broader discussion because I think it is so important. I know with me when I talk to schools, they will almost always tell me the child has to be either enrolled full time in our school or they have
Mhm.
to be in home hospital, and they cannot do both, and they cannot be dual enrolled, and they can't, and I
Yep.
have to really, really work with them to explain the slow reintegration. So for parents who aren't really familiar with doing that, can you talk a little bit more about how that works?
Sure. And you're absolutely right. I hate that law that says, homebound instruction is, you only qualify for it if you are out 10 straight days in a row, fully out. And so we are frequently asking people to consider creatively interpreting those kinds of rules. So what happens again, we're taking a kid who has not been in school or been in school very little for, weeks to months. And we want them back in that school setting. And as I said, you can't just say, okay, look, now we're going to, give you some maybe helpful pain medication and enroll you in PT. And so tomorrow you should start going back to school all the time. It is absolutely a process. And you need to build some early success and help them kind of get over, again, because even if they aren't kids who dealt a lot with anxiety beforehand, almost anyone's going to be anxious in that situation, having missed a lot of school and the idea of trying to return to something that is painful and challenging. So we will try to identify, the least threatening parts of the school day, whether that's because, mornings are really hard and I can't get up very comfortably until, 10 o'clock. So maybe we'll start later in the day, or math is super stressful for me. So we're not going to start with math class, whether it's time or subject. We try to find kind of the sweet spot where they may be able to have some early success. Start small like that. Hold it. It's like a pacing plan, hold this thing that you're comfortable, or at least relatively less uncomfortable doing, for a week or so. Feel like you've got a little bit of, agency there, and then we will slowly build from that. So now, okay, you've been able to go to school for an hour a day this week. Let's try for adding a second class, or for, a certain block of time the next week. And try to build it like that, working with the school so they understand obviously what it is that's happening. This is an incredibly big ask of parents. I find many times, because all of a sudden it's like, okay, well, now you must get your child to school at 10 in the morning and pick them up at 11:45. So it demands quite a lot from families to commit to this, because obviously there's not school transportation available at every hour of the day, unless you really can demonstrate some specific needs. Um, so it's not an easy thing for anybody to pull off, but I think it is key, to getting back, is to having that little bit and building off of that and developing some confidence, and tackling it in that way, like an exposure for anything that's been difficult, to engage with over time.
Absolutely. And if the child already has friends, then it's nice if they can, go to the period before or after lunch
Yes.
so they can
With
see them at lunch. And I find if they don't have friends, to even if there's lunch clubs, to go to a lunch club, I have found that then kids have really enjoyed that, made a friend there, or really like the topic. And so they'll go for that and then stay for the hour after, and build that way.
Yeah,
Um,
sometimes we just start with lunch, or just start with sitting in the guidance office for
right,
45 minutes. We really
right.
have to kind of figure out exactly how much feels possible to start.
Yeah. And sometimes there's a resource room where they can even just do some of their, let's say, online work or their makeup
Mhm.
homework sitting in there. Can you talk about 504 plans and whether they are necessary to get accommodations? And if you want to touch on IEP versus 504, that's great too.
Sure. And again, I find this varies not just by type of school, which I know is a question that we can get into, but, just from school to school. I'll meet with families and say, do you have a 504 plan in place? And they will say no, but we just ask for things and the school gives it to us. And some schools can do that, and that's their sort of philosophy, whereas other schools, it really, everything needs to be in writing. So I try to get sort of the vibe. Um, I think it's very helpful for many of our families to have a 504 plan, because it does, kind of formalize some of the accommodations, and it also is a communicative tool. So, it can help to get it consistently delivered across teachers. I know in my kids' high school, it's in the electronic system, so that, go to my daughter's Aspen account, and it says right there that there's a 504, and then each teacher can click on that and sort of read what it is that she needs. 504s are typically focused on accommodations that can be delivered within the sort of typical classroom setting. And that's where we like to see a lot of our kids, start, is let's see if we can accommodate the regular classroom environment, if that's where you were before, to help you kind of stay in that environment, as opposed to an IEP, which usually is a, more of a special education, seated plan, which often can involve things that happen outside the typical classroom. So it's, again, the 50, and they both are dictated, but they sort of fall under different laws and have different, systems around how often you need to update them, and how, sort of how much teeth are behind them. So generally a 504, is kind of the lighter level, but it does, again, allow it to be formalized and hopefully more consistently administered across classroom settings. So I find that I tend, if I'm not sure, I will err on the side of requesting or suggesting a 504 with the family, and only leaving the non-formalized, accommodations when they really say, absolutely, our school just does what we ask.
Right. And I would say most kids are not comfortable doing this, but some really are. If the child is comfortable literally handing their 504 letter to their teacher and saying, these are
Mhm.
my accommodations, so that there's that kind of face to
Mhm.
face, the teacher often will kind of take note of it more, I feel. Um, Can you talk a little bit about remote schooling and what to do when kids are interested in online instead of in person and maybe sometimes having a combination of the two?
Yes, and of course, this landscape has changed so much since 2020. Um, in general, my bias is I like to see kids in brick and mortar school settings whenever it seems humanly possible. I may be a little old fashioned about this, but I really believe that it's easier or more traditional to be able to um, have the sort of typical social development piece when you are actually physically with other kids. So and at least previous to the pandemic, it felt like remote schooling was a really unusual thing to do. Again, before 2020. So it really felt like we were saying, okay, you've got this really unusual thing, and we really need to like totally upend the regular system for this. So I really tried whenever possible to get kids into typical school settings. Again, more for the social than for the academic piece, because I do think that academically, some kids really do benefit from virtual. Some kids even do better if they do better in a sort of one-on-one and can get some of that or whatever happens. Um, Again, it's become more common, and it's like less of a sort of strange thing to do post pandemic. I still have this bias that socially, I really like to see kids in a regular setting. But that said, sometimes it's the right starting point. Again, I'd certainly rather see a kid engaged in a remote school situation than no school situation. Or I meet a kid who's really so close to finishing school, they're in the 12th grade or whatever, and they've been doing things in a certain way. It may be hard to really say let's completely go back to square one. So if they're kind of making progress in a remote situation, then we work on how to make sure that they're getting the most out of that situation. So I won't say I never like it. There are situations in which I think it does offer a good compromise. But there's still something about sort of being in a space with other people that I think is very helpful in terms of kind of part of the whole rehab process of functioning in the world. But I know the world is looking different every day.
No, but absolutely. I think the socialization is a huge part of recovery. I do find that the combination sometimes works if they're
Mm-hmm.
in school for a couple classes and then they take a couple other classes online that they can do from home. Or I have some clients who go to school 3 days a week, let's say, and 2 days a week. They have a home
Mm-hmm.
hospital teacher who helps them with the other subjects or some combination like that so that they're in school
Mm-hmm.
for part of the time, but that not full time. I think can also be helpful. So what about the question that we got earlier about public versus private school settings? What do you see in the differences there?
Yes. I see some pros and cons in both directions. So public schools are legally bound to, offer appropriate access to education, to honor 504 and IEP plans, and have a whole, predetermined process in place for that. Whereas private schools don't necessarily have to um, conform to a lot of those regulations, and so in some cases, you can find that it's easier to get things built in a public school setting. On the other hand, um, private schools usually being smaller and a little bit more able to individualize a kid's experience, sometimes they can do better, and they're not, sort of stressing out about needing everybody to pass a particular standardized test. And so there is more flexibility in terms of meeting benchmarks and things like that. So it really can work both ways. Um, I have sometimes had the experience of particularly like parochial schools, sometimes having a hard time with the idea of treating one kid differently. If if they're in the classroom, they really need to be doing the same things in that classroom that other kids are doing. Um, so it, Again, broken record, but I feel like you have to kind of get the vibe of a certain school and understand what the culture is, what the how much they are tied to certain regulations or in school standards, and then figure out from there how to work with that school. And of course, there are times when you feel like the right advice to a family is actually let's maybe look for a different school. Sometimes if there's just been a lot of history of contentiousness and the families really felt like they've kind of built up some bad feelings, and they don't really, it's going to be really hard to rebuild that trust. Sometimes I will suggest maybe let's look for other options. Or if there's really such a huge element of school avoidance that's very anxiety based, then sometimes I will try to guide families toward, certain schools that are really created for kids with school avoidance, school anxiety, and have really a lot of supports in place for helping kids tolerate the anxiety piece of it, which there are some specialized schools around that do a good job of that.
Great, thank you. We have another um, parent asking how to deal with the PE requirement for
Mhm.
students who maybe have HEDS or chronic fatigue or, post-exertion malaise or pain. The schools often are strict about this PE requirement. How do you handle that?
Yes. I have generally found in the New England region that doctors' letters tend to go a long way for that. So if you've got a letter from a physician or a nurse practitioner or someone that says, please allow this child to modify their PE requirements, we tend not to get a ton of pushback for that. Now, sometimes that can mean, okay, so no PE and you can have a study hall. Sometimes it means you need to sit there with the stopwatch and time everybody, or you need to write a paper. I've had kids had to write papers about, the history of basketball or whatever. But rarely have I, in many years, had a school say, we read your doctor's letter and we still think this kid needs to, be playing volleyball 3 times a week. Um, so haven't found if we really write it that they totally push back. But again, some of the solutions feel better to families than other solutions around that.
Yeah, sometimes I've had schools allow um, patients to count things like PT
Hmm.
or yoga or something that they're doing outside of the school. Sometimes they'll count that. Um, I have had a client, for example, with HEDS and dizziness and abdominal issues. He was on the swim team, but he just was allowed to just stay in the pool for as long as he could, get out, take breaks, go back in, never do any swim meets or anything like that, but just, be there in the pool a little bit with the other swimmers and that would count. So, but sometimes they make them do a formal PE course with actual academic work. So I think schools can be very different on that, but I agree that a letter goes a long way for sure. Um, one of the parents is asking what you do if if the school completely fights you on everything and just keeps failing the child out of school because they won't make any accommodations.
That is when it can be very useful if you are able to do so to connect with an educational advocate. These are people who this is what they do. They go into those 504 or IEP meetings with you. They know what the schools are legally required to do. They are good at advocating. Um, I think there are definitely situations where you need to get some expertise in there like that can be incredibly helpful. Um, Even beyond asking like one of us to either write letters or virtually attend meetings, which we can also try to do. But those educational advocates, if you get a good one, can be extremely helpful just because they know this stuff inside and out. They kind of know where the pushback tends to happen and what the workarounds might be. But as I said before, there are times when you kind of have to say, all right, this just isn't going to be the right environment for my kid. And that's hard because then you're faced with either finding a private school or moving, which are not easy things to do. But I certainly have seen it happen because of sort of untenable situations.
Yeah, and I've also seen a few parents who threaten the school with a lawyer, saying that they have a lawyer, and shockingly, the schools often will back down when they hear that, and do what they're supposed to do. So that's another possible way, in addition to the advocate.
Mhm.
Um, can you talk a little bit more about the virtual reality intervention in the school setting that you
I would
mentioned?
love to. Yes. So again, this is something that kind of emerged out of my longtime interest and work in trying to help kids improve school functioning. Um, and we have, some really creative therapists in our intensive rehab program who work on school as a goal and will try to create sort of school situations in the context of being in a hospital rehab program. So they'll, get a bunch of people out in a hallway and try to make it a crowded hallway, or run the kids up and down stairs with a backpack on. But it felt like, kids were always aware that they were doing these things in a clinic setting. And I wanted to see if we could use a simulation to really make it feel more like they were in a school and really dealing with their challenges. So I've been working toward this vision of creating a virtual reality school simulation that can be individualized. So, if one kid really identifies, that their hurdles in school are crowded hallways and bright lights, and these kinds of things, that can be sort of the piece that they work on in this simulation. Whereas another kid, it may be about having conversations with their peers, or trying to negotiate with a teacher about, having some extra time on an assignment. That it could be tailored to particular barriers and fears that kids identify, and also that it can be sort of progressively more challenging. So, if a kid's trying to work through a challenge of going through a crowded hallway, the first hallway has, 10 people in it, and then a week later they're back in the hallway and it's got 30 people in it. And so I've been working and trying to partner with developers to sort of bring that to life. And what we did to start with was really connect with the stakeholders. So we sat down with kids in our rehab program and kids who had gone back to school after our rehab program, to try to get them to identify what are the kinds of challenges that you're thinking about the most, or that turned out to be the hardest things after you left this program, so we could figure out what was important to build in. We also talked to the clinicians in the program to really see, how would you want to use something like this clinically. And it can be used in physical therapy, it can be used in cognitive behavioral therapy, really trying to make it a versatile kind of tool that different therapists could draw from. And then once we had a little bit of a prototype, having both patients and clinicians engage in that and give us more feedback. My favorite feedback in that process was multiple kids went into this scenario and said, this hallway is too clean. You need like trash on the ground. You need backpacks like next to lockers. Like, it's way too neat in here. Would not have dawned on me that I needed to make it messier in the hallway. But, so you really need the kids to say, this doesn't feel right. This is what I see. This is what I really experience. And so it's been really
Right.
fun trying to work toward that. Still a work in progress, but we're hoping that can be a tool that can really try to move things forward with working towards school functioning as a goal in our rehab program and beyond for other kids too.
Yeah, that sounds really exciting. Uh, that's wonderful. That just sounds like an amazing tool. Can you talk a little bit about school functioning, school reintegration, um, school accommodations when it comes to neurodivergent kids who have pain?
Yeah, absolutely. That's a huge group and definitely a challenge for a lot of those kids. Um, again, I think drawing in, making sure they've got all the resources. So you've got maybe a plan that addresses the pain piece, but you're also connecting with others who may be able to help with other pieces of that. And there's certainly overlap. So um, kids that have a lot of sensory sensitivities and pain identify a number of struggles in the school setting. I'm thinking particularly of a patient that I worked with who was on the autism spectrum and had a lot of sensory intolerance and some social issues and chronic headaches. And we really, he was a kid who had not been able to tolerate school at all. And we really worked on this gradual plan to get him back in. But a lot of it was around trying to manage some of the stimulation in the school environment. And one of the keys in that case in particular was really partnering with him. He was great at sort of helping to problem solve around what he could do. So as we worked on ways to kind of, manage the bright lights, maybe timing his entrance to school so it wasn't when everybody was coming in. One of his things was struggles in the hallway. And what he did was he recorded the sounds in the hallway during like regular classroom passing. And he integrated it into a playlist of music. So he'd be listening to his music, and then all of a sudden there would be the sounds of the hallway, and it would really rev him up and overstimulate him. And then he would work to use the skills we were working on for relaxation to calm himself back down. And as he did that as sort of a like an intermittent random stressor that came at him that he had some control over, he could then tolerate more of it in the school setting. But again, I think sort of drawing from getting other people involved, I really worked with folks in the school who are already aware of some of his, autism issues to really kind of come up with a plan for success for him. So it does up the challenge, but it can be done.
Excellent, thank you. Um, we have a question talking about My daughter recently started back at school and she had worked successfully for a year to reduce her stress and anxiety. Now that she's back, she's busy and caught up in the environment and can see her stress increasing. Do you have any suggestions for techniques to manage this when she doesn't seem as interested now that our focus has shifted from medical care to school demands?
Wow, absolutely. So hopefully the skills that she learned when she was dealing with pain, hopefully the way that those were talked about was, we would say like, these are skills that will serve you, throughout your whole life, even if you never have pain again. Like being able to recognize when your body starts to sort of rev up in those ways, and when and how to use these things to bring it back down, help not only with pain, but all the other things that happen that sort of rev up the nervous system. And so I would try to use that language to bridge, what helped you with pain. Let's try to make sure you're just doing this, proactively, not to sort of set any expectation that she's going to have a pain flare, but to sort of say like, we know that stress can make you more vulnerable. Let's make sure you're doing what you know how to do to make sure you stay healthy, and are able to keep doing all of these things. And just, a little bit of maybe reminding around pacing, and trying to recognize when maybe you do want to take a little bit of a break and not keep ramping up. Um, I think those might be helpful. Again, I get it. Sometimes kids want to put that all in the rear view and just be doing the things everybody else is doing and not think of themselves as like sort of specially vulnerable people. And you want to really try to walk that line between, you don't want to label them as, needing to be kept in a bubble, but you want to remind them that maybe using these things in a sort of wellness, proactive kind of framework may help when stress gets going.
Absolutely. I find that when I'm working with families on school or any functioning with pain issues, sometimes the parents are not on the same page. Sometimes one parent wants to pace the child slowly, and the other one says, "Oh, they need to suck it up and just go for the day." How do you work with that, and how important do you feel it is to make sure that the parents are in agreement with the school plan?
Yeah, that is definitely a challenge, and it's a frequent situation. Um, I think it involves a little bit of kind of family therapy and parent guidance in there, in that you want to sort of try to find the middle ground. So, sort of pointing out that there are advantages to both these things. It's good to be protective and think about, what's needed in a situation to set up for success. But sometimes you also need that piece where somebody kind of helps push you a little bit, to kind of get over some of those hurdles. And maybe there's a way to sort of bring those two influences together. And maybe what they're doing is trying to kind of cover both those ends. So can we find a middle ground? Um, maybe somebody has a little bit better success communicating with the school than the other, and trying to kind of, play to those strengths, figuring out that maybe this can be your job. You communicate with the school around these things. You're the one who works with the kid to sort of set their plan and hold them accountable. I think if, probably both, in many cases, both parents are coming at it from a place of really wanting to support their kid and see them thrive, and they see it as a different route. So trying to give them things to help them feel like they're helping move it forward, but maybe recognizing that those should be different roles could be helpful if you really feel like you can't get everybody on the same page. And then helping maybe talk so that the child that you're working with understands, what that feels like, and how they kind of walk that line as well.
Yeah. And how do you help a parent whose child is constantly texting them or calling them from school and saying, "I need you to pick me up. I need you to pick me up." You know,
That's so hard. I know. Fortunately, it seems to be we're finally getting to the point where states are passing laws about this, and we're trying to get the phones out of the school. It's too late for my kids. I have a 20-year-old and a 17-year-old, and it's not going to help them. But we seem to see it happening. But it's a really hard thing. You know, the more you can find ways that you aren't checking your phone, and they can't necessarily get a hold of you all the time, the better, because those moments will often pass. If you let them, they're sort of coming at you in their moment, but if you kind of can let it ride out, often they find solutions. Um, but it's one of those times when it's sort of heartbreaking. It's like pulling at your parent heartstrings, and part of you really wants to go and grab that kid and take them home and just take care of them. But another part of you probably realizes like the way for them to succeed is to push through this discomfort a little bit. I think this is where having the level of trust you have in the school really makes a difference. It is easier to be the tough one and to say, look, I want you to write it out. Let's check back in an hour, or something feels better if you feel like they're in an environment where someone's watching out for them at least a little bit. Whereas if you feel like you have no idea what's going on, it's really hard. It's really hard to hear those cries for help and not feel like you need to respond.
Yeah, and I feel like it's important to have a clear plan. Like you are allowed to text me twice during the school day,
Mhm.
just to get support. Or if you feel like you need to go home, you need to go to the nurse for 20 minutes first and listen to your music or your relaxation or whatever, before we reconnect, some kind of plan in advance so that it's not every day just to like, I don't know what to do, but it's
Right.
it's set in place what the
Yeah.
plan is.
And right. And then if you've had this discussion beforehand and your child knows that that's where you're going to respond, um, then, and their heart, they know what you're going to do in that moment.
Right. I also find it's helpful if the parent has something that they really do need to be doing. So
Yes.
if they don't work, volunteer, or I even say just pretend you're in a meeting for something.
Exactly. That's what I mean. Like, if, try not to be
Because
so connected to your phone that you have to answer.
exactly, exactly. Because otherwise they know you're available to come anytime.
Hmm. Hmm.
We have
Yeah,
a
I,
couple
I
questions.
work from home on certain days. I know my daughter texts me on those days. Like, can you bring me this thing?
Yeah,
But
exactly.
never
Right.
does it on Tuesdays because she knows I'm not going to do it.
Right. Yep, exactly. Do you have experience slash research slash knowledge of children, teens using a service dog for chronic pain or mobility issues in school environments? Any thoughts on how this impacts the social aspect of school reintegration?
Interesting. Um, we have definitely had patients with service dogs, and they have been in the school setting. Um, and again, I think it's tricky. It depends on the environment. Um, I had a patient who really felt like her service dog was sort of a helpful cue, like sort of to keep people from getting too close to her, both I think physically and maybe psychologically, but certainly physically. Whereas other times, sometimes, um, when that same patient I think was transitioning to college, I sort of pointed out to her that everyone's going to run up and want to pet your dog, so it's actually going to bring people in. Um, so it's hard, and I really encourage people to really try to think through, what are the impacts of having this support, because they're not always exactly what you expect. um, I had somebody get a service dog, and then it turned out they really needed to be with that dog, kind of 24/7 for a training period, and they hadn't quite realized the level of commitment that was, and how isolating that was, because they for a period of time weren't supposed to bring the dog out other places. And ultimately that did not feel like a good fit. So I think all I can say is, like, try to project and think about what this really will look like and feel like, and what it will do for you, but what also it might change in your life that maybe you weren't necessarily looking to change.
Yeah, my issue with it also, as much as it can be helpful in some ways, in addition to what you're saying, which I've also found, is that with kids, what we're really, really ultimately trying to do is pull them out of the sick role, out
Right.
of the chronic pain role, out of the patient role, and into, I'm a artist, or I'm a dancer, or I'm a mathematician, or whatever, something, some identity that's not tied
Mhm.
to a medical disability. And by having a service dog, it really screams, I am, you know,
Mhm.
disabled, or I am chronically ill. And it keeps, I think, the child's focus on that and the other kids' focus on that. And we
Mhm.
want them to become more integrated in a non-medical way.
Absolutely.
Um, One of the parents asked about their child with chronic abdominal pain and fibromyalgia and FND, and they're wondering if you recommend inpatient treatment to help with pain and functioning and then trying to reintegrate to school, or is it better to find a team of outpatient doctors to work and try to have them go to school in person for maybe one class?
Mm. What I tend to do, and again, recognizing there are situations that don't fit the bill, but I tend to try to start with an outpatient, a coordinated outpatient approach, really trying to get physical therapy, cognitive behavioral therapy on board at the same time, even if they're not actually integrated pieces. Um, and give that a trial. Try to see if we make some improvements. Can this kid learn some strategies, for a period of a month or two without, kind of turning their life upside down, to the extent that one needs to do to commit to something inpatient. Um, so that tends to be my go-to, my sort of first pass. And then if after, 6 or 8 weeks, it's not feeling like these things are helpful, then I tend to look at, whether there's a higher level of care that might fit the bill. And I know it's a little bit of a challenge in terms of school, because it's either you're going to school a very small amount and maybe not progressing as quickly. Whereas if you kind of pulled out altogether, maybe you'd make enough progress that when you got back, you could sort of almost launch right into things. So it's sort of a different way of looking at it. But um, I do tend to try to start with the least disruptive approach and then see if there can be success.
Mm, okay. We have about 5 minutes left. I'm wondering if in those 5 minutes you could give a little case study of one of your patients there.
Sure, yeah, absolutely. Um, I can talk a bit more about I started talking about the patient that I worked with who um, had chronic headaches and also on the autism spectrum. Um, I can give some more details about that one. So he was a 16-year-old boy in high school. He had been actually recommended fairly early on, to the last question, for our intensive day hospital program, given the extent of his disabilities. But that environment felt too stimulating, too many people, too many lights and things like that. So instead, he went to our comfortability workshop, which I don't know if everyone is familiar with this, but it's a 1 day pain management workshop that was developed here at Boston Children's and has been disseminated to a number of other hospital settings across the country and internationally. 1 day skill building workshop, and he kind of picked up some skills and focused particularly on his school reentry plan. But then really couldn't quite pull it off just on the basis of having done that 1 day of planning. And so he came to work with me to really help follow through on that plan and address some of the school issues. So again, with him, given that he had multiple needs, not just pain, but also sensory sensitivities and some other social things, really was important to connect with the school professionals pretty quickly and kind of get their sense of things. He kind of figure out, who kind of a champion was in his school setting, which is something I try to do a lot of times. Who's the right person? Sometimes it's the nurse, sometimes it's a guidance counselor, sometimes there's a student support services person. Sometimes in like particularly the elementary school level, it could be a teacher. Um, for him, it was somebody in guidance who was kind of familiar with all of his issues and really got their perspective on what they were seeing, and then working with him and his mom. So we identified that a lot of the triggers for him were lights and noise. He also was struggling with the fact that one of his classes had a long-term substitute. And so this idea of, sort of transition and not being what he was expected in that classroom made that class particularly challenging. And then also the more we talked about, what was going on in the school setting, the more he would disclose that there was a lot of peer teasing. He was, sort of not a typical appearing kid, tended to wear a trench coat, and so got a lot of jokes about, school violence and things that really upset him. But it was hard for him to sort of change, the way he presented. So working gradually on trying to feel okay about maybe changing what he wore, feeling like he was avoiding the teasing piece. Um, Trying to work on those. And then this was in an urban school setting. And so there were a lot of very rigid policies. So butting up against the idea of, he needs to be out for 10 days or he can't qualify for any homebound instruction, trying to explain why this, needed to be addressed differently and giving him some support to try to catch up on things while also setting some expectations about just physically being in the school space and really try to take the pressure off of him in terms of you don't need to be progressing academically. You are just tolerating being in that space. So the tools, the kind of the keys here were collaborating with the counselor, developing these exposures and framing them as exposures. And this is, again, he came up with the idea of listening to the school noise and working on that. And then another piece in this case was mom was a great advocate. And so really backing her up and empowering her to talk to the school, to ask for things. She was, fortunately for me, very good at it and just kind of needed some guidance about how to do it. But she was a key partner in really getting him back where he needed to be. So what we came up with was, following a very long, prolonged absence, they did finally allow him to engage in limited school attendance on a gradual basis. And we sort of set this goal of one class a day to start with, getting him the individual support to catch up on the missed work, asking to scale down the assignments from the missed work so he could just, as you said, demonstrate proficiency and not get bogged down in all of this busy work. Um, and encouraging him to use his techniques, his pain management techniques in school. So really, in a very clear-cut way, saying, okay, you're going to predict this is when you're going to take a break. You're going to go to this low stimulation environment. You're going to use these skills. You're going to re-enter class, and really working that out and monitoring that with that designated school liaison. I would say those were kind of the keys to success for him. And from there, we could kind of expand out and kind of work toward, gradually longer tolerance of days in school. And he was able to get within like maybe 3 months or 4 months, he was able to really be there for most of the school day, still not doing the class with the long-term sub, because that was just a really challenging one for him. So, kind of meeting him a little bit where he was at, but really helping him to kind of expand what he was able to do. So,
Yeah, I want to emphasize the point you made about sometimes just being in the classroom is enough.
yeah,
Um, I definitely tell my clients that the first goal is just have your butt in the seat. And
yeah,
doesn't matter if you're even paying attention to what the teacher's saying or know what's going on around you, just be there as a first exposure. And then maybe start to do the work within the classroom, take notes, pay attention. And then the third step is doing homework. So I think that's a really important point that you made. All right. Well, thank you so much. This has been really informative and I think really helpful because obviously school is the job of kids. And so this comes up with every kid with chronic pain. So I really appreciate all of your insights and your experience. I just want to remind everyone that there will be a replay of this webinar, and all CHIP webinars are on the CHIP's YouTube channel, and the link is in the chat. And finally, please again consider donating $25 to CHIP if you find our monthly webinars valuable. And donations can be made at mychip.org/donation. Thank you so much again, Dr. Logan.
thank you. It was a pleasure.
Take
Have a
care.
good day. Bye.